How does QCT diagnose osteoporosis? Imagine getting a detailed picture of your bones that goes beyond what a regular X-ray can show. That's what Quantitative Computed Tomography, or QCT, offers when diagnosing osteoporosis. Unlike the common dual-energy X-ray absorptiometry scan, which measures bone density into dimensions, QCT creates three-dimensional images of your bones, mainly focusing on the spine and hip. This allows doctors to measure the actual volume of mineral content in your bones, giving a more precise picture of bone health. QCT measures the bone mineral density in units of milligrams per cubic centimeter. It looks specifically at the spongy, or trabecular, bone inside your bones, which tends to lose density earlier and faster in osteoporosis. It also assesses the outer, denser cortical bone separately. This distinction is important because losing trabecular bone can be an early sign of osteoporosis, and QCT can detect this loss sooner than other methods. When a QCT scan is performed, the targeted bone area is scanned, and the amount of mineral content is calculated. The results are then compared to reference standards that take into account your age and sex. For the spine, QCT uses specific thresholds. If your volumetric bone mineral density is below 80 milligrams per cubic centimeter, it indicates osteoporosis. Between 80 and 120 milligrams per cubic centimeter suggests osteopenia, or low bone mass, and above 120 milligrams per cubic centimeter is considered normal. For the hip, QCT can also generate a T-score similar to what is used in DXA scans, helping doctors classify your bone health. QCT is especially useful when DXA scans might not give accurate results. For example, if you have spinal deformities like scoliosis or degenerative changes such as arthritis or osteophytes, these can artificially raise DXA readings. Obesity can also interfere with DXA accuracy. Because QCT isolates the trabecular bone, it avoids these artifacts and can detect osteoporosis earlier or in cases where DXA might miss it. Research shows that QCT can identify osteoporosis in many patients who have normal or only mildly low readings on DXA, making it a valuable tool in complex cases. Another advantage is that if you have already undergone a CORT scan for other health reasons, such as abdominal or chest imaging, doctors can sometimes use those existing scans to opportunistically screen for osteoporosis. This means no extra imaging or radiation exposure is needed, which can help catch bone loss early without additional procedures. In summary, QCT diagnoses osteoporosis by providing a detailed, three-dimensional measurement of bone mineral density, focusing on the spongy bone inside your bones. Its ability to overcome some limitations of DXA, especially in certain patient groups, makes it a reliable and precise tool. However, interpreting QCT results requires understanding that its measurement thresholds differ from DXA, and medical professionals will consider your overall health and risk factors when making a diagnosis. Always consult with a healthcare provider for personalized advice and to determine the most appropriate testing method for your situation.